Dr. Leffler, how we doing?
Good. How are you?
Good evening.
Can you hear me?
Yeah, you sound good. Did you get a camera?
I mean, same, same as I've always had.
Yeah, or maybe the microphone. Yeah, it sounds a lot clearer right now. That's great.
Good. I'll take it. Maybe it's just that time of the day, the signal is better. It's possible.
Yeah, true. Yeah,
Yeah.
it's pretty good. But yeah, I just got home from a long. Some of these days are long. It's like I didn't expect. I mean, that sometimes in residency you're like finishing up tasks and stuff, and then you stay later to prepare for the next days, and I didn't realize how much like it's really just catching up on notes, I think. And some days you're able to get ahead and you're done at the end of the day, but like today it was an hour and 10 minutes of notes. I was the only doctor in the office today, so I saw everyone. I could book extra rooms, but yeah, it's just I love it. I'm enjoying it. A lot of work. I just gotta
Good.
find time for exercise and stuff. But oh, and hey, I was able to go over this case prior this time. The coolest thing, are you using ChatGPT at all? No, it's kind of like a search engine. Have you heard of it?
Yeah, of course.
It's been excellent. And so what I did on my way home before I went on, I copied the link of when you sent it to me a couple weeks ago. And then I inputted a ChatGPT and I said, give me the premise, the summary, any key points, what happened here, what should have been, how would the person would have been protected legally, how can we learn from this to make sure that we, and it gave me the whole thing. I put in an audio mode so I could hear it talking to me, and it
Yeah.
just went through the whole thing, boom, boom, boom. Fascinate this AI stuff.
Well, your job won't be replaced.
Yeah, that's true. That is, well, not for a while at least. I mean, these robots that they're building out there.
I don't foresee it. Not in your professional lifetime, anyway. Maybe next generation. I don't know, but I don't see it.
All right, good. I trust you.
Well, that's just my crystal ball.
Excellent. Let me pull up that article, and then we can get going on this. Yeah, here we go. Okay, this should bring it up to the website. I can hit share. How's your day going, by the way?
My day is going okay. I'm getting ready for a lengthy work trip. A few stops in Wisconsin and Colorado. And then I'm headed to Utah for my own, amusement. I'm doing a half marathon in Utah a week from Saturday, I think.
Oh wow, a half marathon, so
13.1.
13.1.
Yeah.
Oh, very nice.
Yeah.
You running it?
Yeah. Yeah.
That's exciting.
It'll be number 22 if I, yeah.
That's right. We were talking about this. You started a couple years, not a couple, but you could start a little bit. Yeah.
I started late. I was 54 when I started running.
I don't know. That's late, but yeah, that's
Yeah. But now my knees are starting to first feel it. It's like it catches up with you. It's tough on the knees. But you know what? I'm in good cardiovascular shape. So that's really important.
it certainly is. Yeah, and so that's in Utah. Okay. What October?
Yeah, October 4th in St. George, Utah. So we'll see. I haven't been to St. George. It's near Zion National Park. We'll see. Maybe we can get out there for a day. Although I've been to Zion before, but maybe we can do it.
That should be nice.
Yeah.
Great. Excellent. You'll have to let me know how that goes. You've been doing a lot of traveling. Yeah, you were just away.
Yeah. I was just where was I? Madeira.
That's right, Madeira.
Yeah.
How did you like that, by
Loved
the
it.
way? Was that a good one?
Absolutely. It was great. It was great.
You'd go back?
In a heartbeat. It's really difficult to get there. Other than the summer months, United flies nonstop out of Newark 3 times a week from June to September. Other than that, other times a year, and that's it. You have to fly through Lisbon or Madrid or London. Kind of a pain. Long. It's long. So we'll see. But probably next summer. That's plan right now. We'll see where life takes me.
Yeah, you'll have to, and I want to know how this marathon goes. You got to tell me if you beat the last marathon,
I
half
won't.
marathon.
I won't. I'm slower, but I've done a few full marathons, and those are in the rearview mirror. The training is just too tough. It's brutal training for a full marathon.
Oh, I know. That's why I don't do marathons.
Have you done a half?
I haven't done a half. I could probably do a half. I'm so concerned of the knees, the hips, the joints. I want to be able to walk,
Yeah.
whatever age that
Yeah.
gets
Yeah.
up there. So, I mean, kudos to you. I don't even know if I would do a half just because, like, I would top, I usually top out around, I train and I do 3 to 4, but I probably wouldn't do more than 6, 7, 8 just because the longevity of it. I run 3 times a week, 2, 3 times a week, when I can.
Hmm.
And I feel a little, I'm 31. You're 31 now. I'm not saying old or anything, but I'm starting to feel little things in the hips, little things in the knees.
Yeah.
So it's very important. Posture, stretching,
Yep.
the running shoes you have. What running shoes do you wear?
Hoka.
You do wear Hoka. Okay,
Yeah.
okay. I'm a New Balance guy.
Yeah. I've worn New Balance, Asics. What else? I don't know, but
I feel like
Brooks.
Asics are just Brooks seem nice, but I feel like Asics some of them are just a little too heavy. You know?
Yeah, I don't like Asics because the gel doesn't stay jelly for very long. I find that it just you lose the effect of it pretty quickly.
Yeah, yeah. I've even heard of some people it just pops in the bottom of their shoe.
That I haven't heard, but I've been using Hoka for the last 3 4 years and really happy with them.
Great, great, great. All right. Well, hey, why don't we head into this? Let me
Yep.
share.
So we're doing the periodontal disease case, correct?
That's right. And thanks for sending me that because it was so easy to find the link. Just boom,
Yeah.
clicked it.
And when we're done,
And
I'll send you next month's, which is for oral surgeons. I have one on trigeminal neuralgia. We'll talk about that later on.
and just to share with listeners real quick, we have even wait, I have it pulled up right here. Even our GP case or general dental or maybe periodontal cases, other specialties, and then the odd numbers, we're honing into oral surgery. We're going into those cases so that listeners know, we're alternating back and forth, trying to get a wide variety. Also, just something I thought I'd show you. In fact, should I bring it at the end? At the end, maybe I'll show you some of the comments we got on a LinkedIn post of the case,
I've been reading
which
them.
you saw
Yeah,
the recent,
yeah.
the one
Some of them
this
got
morning.
pretty aggressive.
You saw that, right?
Yeah, I did.
I was pretty taken. I was. Hey, wait. Let's just chat about that. I was taken a bit back by that. The last two we got. By the way, we got so many people reached out on Instagram.
Yeah,
None from Facebook, but Instagram, and there was another place where I think it was on the YouTube episode itself that people had commented and had great things to say.
good.
But
Yeah,
the LinkedIn, yeah, okay. So
but,
you're
but there
aware.
was one guy on LinkedIn. I think it was either today or yesterday. I forgot which was
Yeah,
was
yeah.
like really over the top. I saw your responses to him. What he's not putting into the mix is that okay, some of the medical facts aren't there, but that's not the point of this. The point is to assess it more from a legal perspective.
I was so surprised. I mean, what did he think? We could just go through this entire case down to the vital sign and the age of the patient and the gender and then how many medications were administered. This is, I was like, dude, if you practice, things get busy. With reviewing cases, there are NDA signed. There's legality to this. You can't give everything away because then the defendant or the whoever's the case is against can identify that, and then that makes the insurance group look bad. Like, what do you think we could? You think we could get down to did the guy tie his shoes in the morning? I don't know.
Yeah. But by
Anyways,
the
yeah,
way, to that point, I always do change demographic stuff. Nothing that changes the important facts, but a man is a woman or vice versa, and 35 is 28, whatever it might be. Just I don't want any issues like that with somebody saying that's me. I don't ever want. Yeah.
right, 100%. And also just another thing. Now, while there are some things omitted that make the case difficult, that's what makes malpractice cases difficult because when you go to the court of law, there are things missing. Well, why wasn't it noted how much propofol was pushed that case?
Hmm.
That's the whole point. Things get busy. Sometimes the critical things are missed. And I felt like that comment, I was like, exactly. This is a malpractice case because things were omitted. There were things forgotten. There were things missed. Like, that's the whole point. Note everything. Anyway,
Yeah. Yeah. And we'll talk about
that was great.
documentation in today's case as well. So
Yes, yes,
it's a
yes, yes,
common
yes.
theme. Yep.
How do you want to go about this? Do you want to just
I can just go through an abbreviated version of the abbreviated background facts if you like, and take us through the case.
Yeah, whichever way you prefer. I can even. I mean, we didn't do this before. I could read it out loud. Maybe. I mean, people can probably just
Yeah.
could probably read it as we go along. Yeah, or they could pause it and read the screen. So yeah, why don't we do the abbreviated version?
Okay. So this is a situation. It's a fairly, I won't say it's fairly common, but it's not overly uncommon, if you will. A couple of double negatives in there, which means that it's not an outlier, a one off type of case. It's generally referred to as periodontal neglect or just failing to see what was there to be seen during the course of care. So, in this situation, the patient is a long-standing patient of his general dentist. He is a type 2 diabetic, reasonably well controlled. He's also a fairly heavy smoker, uh, admits to half pack of cigarette smoking per day. And he comes into the dentist. His admitted oral hygiene regimen is that he brushes in the morning. He never or rarely ever flosses. And his nighttime pre-bed regimen is that he rinses with mouthwash. That's the extent of it. So it's clearly not a very good oral hygiene regimen that he follows. And he sees his general dentist. He's been seeing him for about 20 years. And he has fairly regular period, not periodontal prophylaxis, but just a general prophy. It's not a deep scaling or anything of that nature. He has a regular old prophy that's done on a fairly regular basis. And the dentist, during the course of those prophy visits, does some spot probing. And early on, he had basically 3 to 5 millimeter pocketing in some areas, and that progressed to 5 to 7, and that progressed to 8 or even a 9 millimeter pocket in an isolated area or two. So he's going along his merry way and he sees this dentist regularly. Doesn't have any real specific complaints. But then, as happens often enough, he gets a new job and he relocates to the area of the new job. And he meets a coworker who says, I have a dentist who will give a free consultation for new patients. So the patient, the original patient, calls that dentist, takes him up on it, goes in for an examination, and the dentist says to him in sort of an offhanded way, "Why haven't you been to a dentist for a while?" The patient says, "What do you mean? I've been going to a dentist regularly for the last 20 years." Well, that dentist hasn't really been doing you any favors because you have a lot of teeth that are in poor repair. Looks like you're going to need roughly 8 teeth extracted. So I suggest that you go to a periodontist and have yourself evaluated. Let the periodontist come up with some conclusions and let them take the reins as to how things should be managed. He does go to that periodontist, is examined. The periodontist concludes that he does need some open flap surgery of various different types and depths, if you will. And he also needs a number of extractions, which, from an ideal standpoint, should be restored in some way, preferably with implants and then restorations on them. So it was an eye opening situation for the patient, so he says. And he's very upset that, by his claim, he was never told by the original dentist that his mouth was in ever descending state of disrepair. So he reaches out and finds an attorney. The attorney does whatever due diligence is done behind the scenes, which we're generally not always privy to. And a lawsuit is filed against the original dentist. And the star witness, if you will, is the subsequent dentist who said to the patient, "Why haven't you been to a dentist?" "Well, you have." "Well, he hasn't been doing you any favors." So that's going to be effectively the star witness. But then we have a setup of a difference of factual views. The dentist says, the original dentist says, I told this patient time and time again he had a worsening condition periodontally. He needs to see a periodontist. But the patient, who repeatedly talked about being short on funds and not having a lot of disposable income, said that he wasn't able to pay for that. So just do what you can for me. Let's try to keep things on an even keel for as long as possible. Unfortunately for the dentist, he never documented that he made any of those recommendations to the patient. He never documented the probings that he did. He never documented what options he gave to the patient and the warnings that he gave to the patient that if you don't go to see a periodontist, you're going to lose teeth. This is not an improving situation. You do need some real intervention. Of course, the original dentist denies all of that, says that all of that was said to him. But again, there's no documentation of it. So during the litigation, there's a phase that's gone through called discovery, where you literally discover what the other side is going to bring against you in a trial, which is potentially down the road. And during discovery, there's a phase known as a deposition, where under oath, the key players in the case, here it's the plaintiff, who's the patient, says, "I was never told any of that." The dentist, the defendant, says, "Yeah, I did." But a savvy attorney on the other side said to him, "Well, can you show me any place in your records for all of these years that you advised this patient to go to see a periodontist, that you noted what your periodontal probing depths were?" And the answer was a very simple no, I cannot, for the obvious reason that there was no such documentation. So the dentist, the original dentist, remained adamant that he had done what he said. He believed that if they went to trial and a jury were to see the two of them against each other, meaning he and the patient, he believed that he would prevail, that the jury would believe him. So he had a policy, an insurance policy, which we refer to as a consent to settle policy. What in fact it is a consent, or you withhold settlement. You have the ability to withhold a settlement by the insurance company, regardless of what your lawyers who are defending you have to say, regardless of what the insurance carrier might think. You can say, "I refuse to settle this case. I want it to go to trial," and let a jury decide the outcome. So he had such a consent policy, a pure consent policy, which couldn't be questioned, and he decided to go to trial. Now, just a little diversion, had he or any other dentist in his shoes who had such a consent policy said to the insurance company, "I just don't want to go through this trial. I want you to settle the case." It's not a totally reciprocal situation. You can say to the insurance company, "I give you the authority to do so," but you can't force them to settle the case. The lawyers working for them may feel that there's no reason to settle it. The amount of money that's demanded by the patient's attorney may be way off the charts and not acceptable to them. So it's not entirely reciprocal, but that's two sides of that coin. But going back to the trial, what happened was, as you can clearly imagine, there's this difference of opinion between the patient, now the plaintiff, and the dentist, now the defendant. As we discussed, you have the subsequent treating dentist being something of a star witness for the patient plaintiff. And what happened in the end was that the jury did believe the patient's version of the story. And one of the more compelling aspects of his story was, well, when I was finally told, he said, by the next dentist that I had the problem, I immediately went to see a periodontist, which is what the original dentist is now saying he had told me to do, but also saying I refused. So why would I refuse to go if the first dentist told me to go, but not refuse to go and in fact actually go to a periodontist when the second dentist told me to? And that's a fairly compelling argument. We might have differences of views, but it is something which apparently figured into the mix in terms of the jury determining that he was entitled to be compensated. They determined that the initial dentist, was negligent in failing to advise him of what should be done and essentially preside over a deteriorating dentition without taking any affirmative steps. So that's pretty much the whole story of the case in terms of facts and legal steps coming to fruition. And as I see it, there are a few very important takeaways that I believe will serve dentists well if they take them to heart. And I don't know if you want to step in, Brendan, or you want me to just continue talking, whatever you prefer is best.
Yeah, yeah, yeah. Just to let's just to switch up some of the things that I was thinking about here, and I asked for some insight. I was thinking, and I asked you for your professional opinion. Having seen these, not only research and study these cases, but having been a part of them yourself, see if you have insight. Like, for example, and this relates to this case specifically. If a dentist recommends treatment, but the patient refuses, let's say. So let's just put ourselves in the dentist's shoes. Where does the legal responsibility kind of begin, and then where does it kind of end in terms of on the dentist end? You know what I mean?
Sure. I think that that's spot on, and that's one of the major points that this case can help us out with. But I think we can kind of look at it that a dentist, let me take that back, a patient can refuse whatever they choose to refuse, but they
Mm,
can't force a dentist to do what the dentist doesn't believe is the appropriate course of care. So in this situation, this, according to the dentist, the patient refused to take his advice to go see a periodontist. But and that's perfectly fair if it were true. I don't know that. That's a difference of factual determination. But assuming it's true, that is the patient's decision to make. No, I'm not going to a periodontist. The dentist then has to step into the picture, both from the standpoint of standard of care, perhaps ethics fits into it as well. Do I continue to treat this patient in a way that I know is far less than ideal, just so that some treatment is done and some treatment is better than no treatment? And that's a fair argument to make, but that can also be countered by, well, aren't you then sending this patient down a primrose path, telling the patient, in effect, if we just keep doing what we're doing, that's an adequate course of care for you. So that's the debate back and forth. And I think it also fits into the informed consent consideration. Because sometimes
yeah.
I'm asked, well, in the informed consent process, we talk about alternatives. You have to provide patients with alternatives. And in this case, though, the alternative is either you go to a periodontist or you don't go to a periodontist, and you let me do the prophies periodically. I would add a word to the informed consent process of required alternatives to viable alternatives.
Mm, mm,
They have to be alternatives that make sense from a dental perspective. So you can't say to a patient, at least from a theoretical standpoint, that okay, I will extract your upper front tooth just because you want to have a replacement with something that I can't do dentally on top of it. I mean, it's a weird, bizarre example, but it's meant to be just way out there. You're not going to do it because there's nothing wrong with that tooth. You're not going to extract a tooth that has no problems with it. You can't do it standard of care wise, ethically. So you just won't do it. Here, it's a little grayer. I agree. But do you go along with this patient's requirement that you will treat me and only with prophies and nothing more that is of a more significant periodontal nature of care? And
mm.
that's a big question. We see it periodically. It happens, I would say, very frequently, and we have to deal with it on the malpractice side of things.
I got another one, especially in the court of law. I mean, we're taught this throughout dental school, right? But look, just to put words to it, why does documentation often outweigh the dentist's word, especially in this situation, right? This is a perfect example of it. And what kind of notes actually hold up legally in the court of law?
Okay,
You know?
so I'll give you an example to answer your question. A number of years ago, I was trying a case in Kings County, New York, that's Brooklyn, and the dentist did not have very good notes. That's just a kind way of saying what the notes actually were. And during the course of the trial, there was some debate about what actually happened, and there was reference to the notes. And the judge, good judge, who I liked very much, but was not afraid to interrupt whenever he felt he wanted to, stopped and said, "Ladies and gentlemen of the jury, if it wasn't written, it didn't really happen." Not the words that a defendant dentist who doesn't have good notes wants to hear, nor words that that dentist's attorney want to hear, because it's being pointed out, just flashing neon lights to the jury, this isn't good. Without making a judgment of the dentist's records, it was a quasi judgment simply by saying that at that time in the context. So the bottom line is that from a legal standpoint, yeah, it holds up. Those records are the legal records, and they will come into evidence as detailed or as scant as they might be. So they hold up legally. I think the question is what really holds up more of a from a factual standpoint, really, what will a jury accept as being good, viable, appropriate notes? And while there's no statute or anything that I'm aware of, but a good rule of thumb that I would say to a dentist is your note should include enough information so that if another dentist were to look at your note in the future, not talk to you, not talk to the patient, not talk to an assistant, just read your note, they would know pretty well exactly what took place. So, what's the diagnosis? What do you plan to do? What did you discuss with the patient? What did you do? How did you do it? And what's the expected prognosis for it? So that's a very broad overview of it. But again, it's kind of simple. Can I see or can I take away from what I see in writing in your chart what you did and know what you did?
Right.
So that's the kind of documentation that I think from a 30,000 foot perspective is gives the picture. More specifically, I would give an example of what's on the other side of that, which is somebody who writes a note and it says to MOD, period. That's it. You don't know why they were doing an MOD. You do know the tooth, You don't know what the MOD was, what material was used. Was there a base placed? Was local anesthesia used? What type of local anesthesia? How did the patient proceed through the process? Did you have a discussion beforehand with the patient to let them know what you were doing, what other options were available to them, and what potential risks existed with it? None of that is there. And that would be a note which, while legally acceptable because it is what the chart says, it's not going to hold up very well, generally speaking, in the eyes of a jury, especially when an expert is saying that's just not a good note, and here's why.
Right. I just realized, Brooke and MedPro, they want me to have an opener. So just really quickly, so at least we have it, just to say, because I wanted to ask you how everything's going first.
Yeah.
I always
Okay.
want to know how you're doing before we jump into the case, but they want me to mention, that this is another malpractice case study review. Here with you, Dr. Marc Leffler, an oral maxillofacial surgeon and attorney who writes these case studies in his role as lead risk consultant at MedPro Group, a malpractice insurance company, and our partner for this series. Okay, just now that we got that off, and it's good. It kind of sets the base where we go. I'll remember to do that in the first couple minutes next time. But so yeah, my next question is directly from that. There's a lot of good notes now, but they're templates. A lot of the software systems, I guess the digital note taking services that we get. I know we use DSN in our office, and now one we can make templates, or I guess they're preset ones, or maybe other surgeons in the practice have used them, and then I kind of inherit them, and then I make my own templates where I could kind of follow something where it's like every case I'm placed in a throw pack, and then like I modify things where, okay, obviously I use septo in this case. This one I only used one carpet of lido. This was local infiltration. I didn't do a long buccal nerve block. So I edit and modify it to the specifics of that case. But, I'm sure not everyone does that. And they utilize these templates to the T, and they just speed through the end of the day. I mean, you saw I got home at 7:45 at night before we came on, because I was just spending an hour and 45 minutes writing notes after I finished at 5 or 5:30 technically, right? And then an hour 15 minutes of notes, got home. But yeah, I'm curious, how does that play out legally in the court of law? Are they looking at templates? Curious if you have any insight on
Yeah.
that.
The way I look at templates is that they're a very good starting point, but not necessarily the end point. So just as you described, it's nice as a foundation, as a skeletal structure of what a note should be. But as you do, it needs to be modified. And what happens often enough is that dentists will just hit a button on the computer, so to speak, for extraction of tooth number 17, full bony impaction, and then the rest gets filled in automatically. Or even less specific, extraction. And there is a template form for that procedure. So to really bring that point home, and you're quite correct that not everybody does that, but I saw some notes from a procedure where it was tooth number 17, a lower third molar that was removed. It was a full impacted third molar. And the template had a few things which, well, it was just a template for an extraction. And it said, using 702 fissure, sectioned mesial distal palatal roots. So as does every other dentist know, that tooth number 17 does not have a palatal root. It's unfortunately, it's easy to look past that because you have this beautiful note that's sitting in front of you. And if you're rushed for time or you just want to get home at the end of the day, you're not going to modify that as you probably should modify it. The answer is it's very easy. The template usually is set up so that I can remove something or I can add something. So you might have sectioned the mesial and distal roots perfectly fine, but you didn't section a palatal root on a lower third molar tooth. And if you think about what the cross-examination would be, you could really feel very unpleasant going through that cross-examination. Yeah, yeah. And on that same template, the template said RX, Amox, or clindamycin. That's how the template read. And that's how the end note was. It actually said RX Amox 500 or Clinda 150. So which is it? Pick one. But it's not, when you have the word or in there, it doesn't leave a lot of wiggle room for you just because that's how the note is set up. And I'm sure that the authors of that software program meant for you to go in there and eliminate one of those. Or if you didn't give either of those, you gave azithromycin, for example, you block both of those out and replace it with azithromycin. Yeah. So those are the kinds of things, as I say at the start, templates are a great starting point, but they're not necessarily the end point.
That's right. That's right. I have two more questions regarding this case that are pretty good that I had written down here. Just and this is a quick one. Could this lawsuit, do you think it could have been prevented if the dentist had used like a informed refusal form? You know what I mean? Like,
Yeah, I think with even less than that, perhaps. I think even if he had at the time of each visit, when he said that he recommended the patient seeing a periodontist, if that were documented each and every time, I think that would be a strong defense. What you suggest is even a stronger position. It's sort of the cousin of informed consent. You're documenting by way of a patient's signature that they were advised this is the suggested treatment, but they are refusing to do so. It doesn't, though, take away the other aspect that we talked about, which is, are you going to go along with what the patient tells you to do versus what you know is best for the patient? While they can refuse, whether it's a signed informed refusal or a contemporaneous note made by the dentist, are you going to still do prophies periodically when you know they need something more?
yeah, yeah. No, that's interesting. And then it makes you wonder, the provider saw the patient for over 20 years. Why aren't some of these things noted? And then that last question. No, I mean, obviously, it's obviously in favor of the patient at this point. This case, it's really unfortunate. But I can tell you, so many times, especially during residency, the patient comes in, you never told me that, you never did this. It's like I did, gave you the instructions. Anyway, let's move on to this last question. When patients sue after refusing care or something along those lines, do juries usually side with the dentist or the patient? From your experience, it's like what have you seen out there?
I think if we could, I'll try to narrow it in, but let me first start wide. That
Yeah,
the
yeah.
vast majority of malpractice verdicts are in favor of the dentist. The majority are in favor. As we kind of bring that lens in tighter and add some specificity to it, there might be certain types of cases which would go outside of that bound and be potentially the opposite. In a situation where there was clearly a deficiency in documentation and other note taking, I think that that probably moves it farther away from the dentist's favor. Because I do believe that jurors, as patients themselves, have a certain expectation that when they go to see a doctor of any type, that what happens in that visit is appropriately documented. And these days, where every office they go to has a patient portal where they can go in the same day or the next day, look at what the doctor wrote down for that visit, they've got it. And they're used to seeing something of a detailed note
Yeah.
that exists. It does bring up a point which you just put into the forefront of my mind, which is sometimes in notes that are repeated from one visit to the next, if there's an error in one notation, it gets repeated over and over and over again because of the copy paste thing. So you have to be aware of that and alert for it. And each time, even though maybe it's just a routine follow up for a more substantive visit previously, it behooves you to just check the note before you actually enter it to make sure, is this accurate still? Because if it's not, that doesn't look so great.
That's a great point. Yeah, it's funny, and I feel like we hit on every take. Oh, this is so important. I mean, every day it's so easy to overlook these things. You know what I mean? And this goes back to those comments that we saw on the LinkedIn post of this, right?
Yeah.
like, yeah, this is what happens, and we all do make mistakes here and there, forgetting this or accidentally copy and pasting this a couple times in the note. But being diligent to read over the note one more time, read the note before you go into that follow-up visit, and then write a new note when you come out of it, or make sure you make the modifications to update it to how it was today. So
There's one other thing I would point out in terms of a takeaway. Subsequent dentist, the subsequent general dentist after the patient moved because of a job change, that dentist did something that we call in the malpractice business jousting, which you might know jousting as a medieval sport from Henry VIII's days, or maybe I've got the wrong king, but it's that time frame. Jousting is in this context is one dentist, presuming they were in the original dentist's shoes at the time, will be outwardly and aggressively critical of what the prior dentist did. What their motivations might be, I can't say, but it's something that we see as a driver of dental malpractice claims, because patients, unsuspecting at that point that something might not have been ideally done for them by their dentist, they go to see another dentist who totally criticizes the first dentist, makes the patient open up their eyes to what they did not previously know, and do so in a negative context so that it brings the litigious side of them to the front and maybe encourages them, if not directly, although we do see it directly sometimes, at least indirectly, to seek out an attorney to redress those grievances that they might have. There's another way. You do have an ethical obligation as a dentist, as any healthcare practitioner, to advise a patient of what their condition is, what you see, problems that you see. You do have that obligation, but there are ways that we can communicate without being so outwardly and negatively discussing of somebody else's work. I mean, you can advise them without the extra added negativity to it.
Hey, and that's such a great point. That brings me down immediately to an example. When I worked as a surgical assistant, it was the year before I started dental school. I was at an oral surgeon's office, and the head oral surgeon, one of my longtime mentors, almost to like high school, there was a patient who came in who there was obviously wrongdoing. It was, there might have been an implant placed into the nerve. It might have been like wrong tooth was extracted. I forget what it was exactly, but the patient came in and I was the assistant in the room helping out. And my mentor had advised them, like, look, unfortunately, as dentists, we're not perfect and we make mistakes sometimes. And he kind of advised them that, the wrongdoing was made up by that dentist, and the dentist took certain steps to, whether it was like, hey, I'm going to pay for this. I took out the wrong tooth. Let me put an implant in this place and fix this. And then after the patient left, I don't know if they went for a third opinion, trying to, take legal course or whatnot. But my mentor had called that general dentist and said, hey, the patient was in here today and I just want to know what happened. How's it going? And really kind of talked it out with that. He did exactly what you just said there. And, I really appreciate that, to be able to know that you have other colleagues out there that will stick up for you and also talk things through with you to prevent complications from happening again. Or, maybe you did have a lapse and you didn't recognize it. And then having someone out there that isn't just ready to just jump on this case to go to court and say, hey, just watch out for this for the future. And that, this might come up. So that's a really good point. I really appreciated to see that in person, in real time with my mentor. You know what I mean?
Sure, absolutely.
Yeah. Yeah. Hey, and Dr. Leffler, thanks again for coming on with these. These are really great. I got so many people reaching out like, hey, thanks for making that. And I can't thank you enough. You're great at this, and you're putting together these cases, so much detail. I mean, you're shooting from the hip with these cases, and you got all the details right away. I love it. I learned so much from these. I'm getting so much, especially on Instagram, that people are saying, "Hey, I listened to this on my drive to work this morning," and so thank you for doing this.
My pleasure. I
Again,
enjoy it.
yeah, yeah. You need to know that. So
Great. Thank you.
I think that's everything for tonight. This is good. This is the perfect time. 30 to 45 minutes. We don't want to overload people. We're right in the sweet spot, and I think we hit a lot of things. I like using ChatGPT to just give me a briefing. Like, I mean, I like to read through it myself prior, but And then I liked that I had some questions for you this time to kind of bring into the picture and how it relates to other people's situations and cases. And does the jury usually side with dentists versus patients? So we'll try and do this for the future. This was great.
Same on my end. I enjoyed it.
Excellent. Excellent. All right. And next podcast, you got to tell me how the race went.
I will. Hopefully I finish vertical and I'm here to tell the tale.
Yes. I'm sure. I'm sure of it. All right, Dr. Leffler. Thanks
All
again.
right.
And
Be well
we'll chat soon.
and keep on enjoying practice.
Yeah, I gotta stretch out this back. That's the first thing I'm noticing.
Yes. Treat that well.
All right. Have a good
All
night.
right. You too. Bye.
We got a quick disclaimer, all right? Note that this case presentation includes circumstances from several different closed cases in order to demonstrate certain legal and risk management principles, and that identifying facts and personal characteristics were modified to protect identities. The content within is not the original work of MedPro Group. It has been published with consent of the author. Nothing contained in this article should be construed as rules for establishing a standard of care or as legal, medical, or dental advice, because the facts applicable to your situation may vary, or the laws applicable in your jurisdiction may differ. Please contact your personal or business attorney or other professional advisors if you have any questions related to your legal or medical obligations or rights, state or federal laws, contract interpretation, or other legal questions. Thank you.